Major funding for Immortality Now was provided through an educational grant from Hotze Vitamins. Founded in 1993 by Dr. Stephen F. Hotze, Hotze Vitamins is committed to delivering only the finest quality vitamins and supplements to meet your patient's needs. Now offering customized vitamin packs, Hotze Vitamins is making it easier than ever for your patients to get well naturally. For more information, visit client.hotzevitamins.com.
Hello, this is Dr. Ron Klatz, and we're here with Immortality Now, another episode, and we're in Las Vegas at the World's Congress of Anti-Aging Medicine with Dr. Todd LePine.
Yes, thank you.
Thank you very much for attending, and thank you very much for presenting. Dr. LePine's area of expertise is the human biome.
The gut microbiome.
The gut microbiome.
There's a lot of research being done worldwide about the human microbiome. And what you have to realize is that there are so many things that we have exposure to that affect the human microbiome. When people take diet soda, that can actually act as an antibiotic and kill off your microbiome. And your microbiome is like a rainforest, and the more diverse it is, the healthier you are.
Now, when you say the biome, what you're really talking about is are you talking about the gut itself, or are you talking about the microflora within the gut?
The microflora, the microbiota, they call it the microbiome. It's the sum totality of all the different hundreds of organisms that are in there, which are a very complex, biodiverse ecosystem.
Mm-hmm. And there are, in fact, hundreds of different organisms.
Oh,
not
yes.
Just one.
Absolutely, yeah. And they're learning more about them all the time. The human microbiome, you can actually categorize into three groups, sort of three major groups. But it's very much unique. So you can even take individuals who are identical twins, and they'll have similar ones, but it'll be just slightly different. And it's also dependent upon different foods that you eat. So people in Japan actually have a specific organism that helps them to digest seaweed because that's part of their diet.
That's interesting. And,
yeah.
It is interesting when I travel around the world, I eat things that, everybody else has no problems with. And I go home that night and I'm like, gee, what did I eat that for? But everyone laughs at me. They go, oh, so funny. You have problems with sea slug. Now, why didn't I ever realize that?
Exactly, right. So it's quite unique. And the other thing that's really important that we are seeing in America is we're seeing an abundance of people being overweight, obesity, diabetes. There are actually studies showing that when you have imbalances of the gut microbiome, that actually can tip you in the direction of having insulin resistance, diabetes, obesity. And
thank you. I was just about to say, what does all this have to do with life expectancy, life extension, and we certainly quality of life issues are clear. If you don't assimilate your foods properly, you're going to be setting yourself up for disease. You end up with disease. You're going to cut your lifespan short.
Absolutely, and one of the key thing that causes aging or excess aging is excess inflammation. We call it inflammaging. And what can happen with the human microbiome as time goes on, depending on what you're eating and other factors, you can get disbalances or imbalances of the gut microbiome, which you call dysbiosis, and then that in turn can lead further down the road towards leaky gut, low-grade endotoxemia, which is basically that you're always constantly having lipopolysaccharides in your blood. It's like being septic at some level. And it's been tied with multiple diseases, cardiovascular disease, autoimmune diseases, Alzheimer's. The list goes on and on.
Yeah, brain fog, skin rashes.
Absolutely, eczema, psoriasis, you name it. So, one of my sayings is, health is paid with good intestines.
And how do you know? It's like, most people feel crummy all the time. It's really sad. If you go out there and you talk to people, maybe I have a little bit of a biased sample because I'm a physician. So when I talk to people about how they feel compelled to tell me what's wrong with them. But even if I say, hey, how do are you feeling good today? Most people say, not so much.
Yeah, they're not at peak performance or optimal. Yeah.
Right.
Yeah. Well, the interesting thing is that imbalances of the gut microbiome is also associated with depression and also anxiety.
Right.
The dysbiosis also is when it's tied in with leaky gut or increased intestinal permeability. That's when things get really messed up. Even kids with autism, there's a large proportion of kids with autism that have imbalances in the gut. And there are
One of the major treatments for autism is adjusting the foods and the fats and the specifically trying to tailor the health of the gut for maximum absorption, and that's one of the most effective treatments for autism that's out there that I'm aware of.
Oh, absolutely. And then also it ties in with gluten sensitivity and the sort of the epidemic of gluten sensitivity that's out there now. And there's also theories about why that's going on. Is it higher gluten content? Is it related to glyphosates, which they spray on wheat? There's a lot of things, but there's more and more people come in with digestive issues and brain issues. It's very, very common.
Well, they're doing their best to corrupt our food supply, aren't they? I mean, with gluten sensitivity, with GMO foods, with the pesticides that are ubiquitous. I mean, I just went out to try and buy some grapes and try and find something healthy. I went out and I was going through the grapes, and the grapes, these are red grapes. Yeah. They're supposed to be like dark red, right? Yeah. They were gray grapes. Really? They were so covered with pesticide residue that they were literally gray, and I couldn't find any that were red. It was like, oh my God, what's going on here? And that's becoming more and more common. I go and I buy produce, and it's very hard, even what's supposedly organic. Yeah. You see this coating on these, on the fruit or on the vegetables, and you literally have to spend 20 minutes washing it off.
Yeah, and the real thing about it is that the pesticides are sort of a slow poison. Mm-hmm. And there's actually a study from Japan that actually looked at people who had higher levels of Parkinson's. It was associated, the more fruit, the more vegetables you ate, the higher your Parkinson's.
Oh, lovely.
Because of chronic, in genetically susceptible individuals, chronic problem pesticide poisoning.
Isn't that a shocker?
Yeah, I mean, a neurotoxin for an insect is a neurotoxin for us.
Yeah, it's just a matter of the concentration, isn't it?
Yeah.
Because that's where all the pesticides came from, was the World War I and World War II research into nerve gas.
Yeah, that's right. Probably the origins, it was a nerve, exactly.
Right.
Nerve gas poisoning. But getting back to the microbiome, there's new ways out there that allow you to study it. There's lots of research, even on severe cases of gut dysbiosis with stool transplantation. Okay. In fact, recently in my talk, there's a paper that they did actually a stool transplant on like a dozen patients, and they were actually quite able to markedly reverse their insulin resistance.
Wow.
Yeah.
That's dramatic.
Yeah, and there's they're doing stool transplants now for patients with refractory C. difficile colitis. There's even some pioneers doing it for autism and Parkinson's. So it's
really,
yeah, absolutely, yeah. It doesn't make any sense. It's like, what's going on there? But it's like and the other thing that's important is to realize is the gut microbiome actually stands outside the body. So it's not it's really part of the planet Earth, if you will. Mm. We're this big hollow tube that sort of carries them around. And also some of the really interesting literature is that they actually can manipulate us in terms of our food cravings.
And our behaviors.
Absolutely, yes.
So it's my gut that's telling me at 11 at night, hey.
Yeah. Yeah, exactly.
I want some coffee and a donut.
Feed me, Seymour. Yeah. Feed me, Seymour. Feed me, Seymour. Feed me, Seymour.
I know. He's right on his shoulder. Yeah. He's always there. He's always ready.
Yeah. And also the interesting thing is there's a recent paper that came out showing that your gut microbiota can actually get jet lagged. So when you go through jet lag yourself, that actually can twist your gut microbiota into creating more fat bugs, if they will. There are certain types of bugs, when they get out of balance, can predispose towards obesity. So over time, you will develop, because lack of sleep and such is a stressor to the body. So anytime the body's under stress, it wants to hold on to calories because it doesn't know if it's a feast or a famine out there. So it just says, we better hold on to calories.
That's a very interesting point. So there's not just you, there's another you.
Absolutely.
There's this just like your how many cells in the human body, a trillion plus cells.
Yeah.
There's probably 3 trillion.
Yeah, it's 100 times. They have 100 times more genes than we do, and there's bacteria are swapping the genes all the time. It's really
They got a big advantage over us.
Absolutely. It's like who's in charge.
We know who's in charge.
Exactly. Right.
Okay, I obey.
Well,
I obey.
And then the other thing, which I also like to say, is that they call the gut microbiota the commensal bacteria. And commensal means Latin for sitting down at the table with. So yeah, so I tell people that, you know, when you're making your food choices, you're not just feeding yourself. You have to feed the bacteria in a healthy way. And if you don't, you're in deep doo-doo, as they say.
Okay, so we've got this other self, and it's alive.
It's alive.
It's alive, and it's thinking, and it's making decisions for us.
It's producing vitamins
and toxins.
Toxins, and also protects us too when it's in balance.
When it's in balance.
Absolutely.
So we have to keep it happy, because if we don't keep it happy, there's going to be heck to pay.
Oh yeah, absolutely. I mean, you know, the Clostridium C. difficile is a bacteria that always sits inside our digestive tract. So it's not like it's a bad bug, but under certain circumstances, like taking antibiotics, it's the analogy is like napalm on a rainforest. It sort of nukes a lot of the bugs, and then some of the bad actors will sort of sense that, and they just sort of take over. It's like, you know, when the cops leave the neighborhood, the crime goes up. I mean, that's sort of what happens.
So what's the take-home message? How do we keep our gut healthy, happy, and not doing bad things for us, and actually doing good things for us?
Well, I think the key thing is really avoiding antibiotics unnecessarily, avoiding artificial sweeteners, expanding your roughage in your diet, the prebiotics, which are the fibers, eating fermented foods, cabbage, kimchi, kefir, those kinds of things. And those are really very, very powerful things to help with the gut microbiome.
Sauerkraut?
Sauerkraut, oh, absolutely. Sauerkraut, fantastic, absolutely.
Pickles?
Pickles, well, pickles, probably sauerkraut, raw sauerkraut's probably better than pickles. Yeah, yeah, and that's been used for, you know, indigenous countries for thousands of years as, you know, fermented foods.
Right.
Yeah.
And so, what's your emergency therapy? You're overseas, and you eat something maybe you're not used to, and you end up with a terrible bad belly. What's your emergency treatment for that?
That's a good question. What you do actually is prophylactically. So what you do is, before you go, there's a specific bacterium called Lactobacillus rhamnosus GG, which are found in probiotics. The brand name is Culturelle. And if you take that like maybe 2 or 3 a day before, you know, a week or so before you're going to travel, and while you're there, there's a good likelihood that you won't get, you know, Montezuma's revenge. But there is no magic one probiotic. It's sort of the symphony of the organisms in there. And there's a lot of research being done now also on soil-based organisms. Because when you think about it, you know, we get our food through the ground, and when you pick it up, it's literally covered with, you know, lots of different types of bacteria. In fact, there's actually, I forget the name of the soil-based organism, but there's one that can actually have the same effect on depression as antidepressants.
Well, you know, it's very poorly, you know, the microbiology of the environment is very poorly understood in medicine.
Oh, absolutely.
And, I can't think of one doctor in 100 who even has a clue as to what's going on. So it's new information.
That's totally
and
new.
It's powerful information. This is powerful medicine.
Absolutely powerful. It is, and we're basically just starting to explore this hidden world. It's like Jacques Cousteau, you know, it's like going into this hidden world, and it's a hidden world.
Indeed. Dr. LePine, with regard to the issue of GI health, there is a ubiquitous use, I mean, widespread use of proton pump inhibitor drugs, commonly referred to as the purple pill. Okay, and there's several of them out there. And, and with proton pump inhibitors, what is the use of this inhibitor? What's the valid use of this medication?
Proton pump inhibitors, the studies are really short-term use for an acute situation like gastritis, bleeding ulcer, something like that. But the problem with the purple pills, if you will, is the long-term use. And what happens is lack of stomach acid causes bacteria to overgrow in the small intestine, so people can develop bacterial overgrowth. You can develop food allergies. You can develop leaky gut. Long-term, it's also associated with osteoporosis, vitamin B12 deficiency. So there's a whole host of downstream effects or side effects with prolonged use of these. And heartburn is not caused by acid. So you want to have acid in your stomach. It is completely normal to have acid in your stomach. In fact, some people with heartburn don't have enough acid, so you actually have to support their acid in the stomach to actually get heartburn relief. So you very rarely do you want to use those medications, and if so, for short periods of time, and try to get people off of them. And lifestyle changes make a big difference. I mean, I've actually seen patients come into my office and they're actually taking a medication that's actually causing their heartburn. And rather than switching the medication or stopping it, the doctor just gives them the heartburn medication. So it's like iatrogenic imperfecta, I call it.
Okay, well, Dr. LePine, thank you so much for being part of Immortality Now.
All right, thank you for having me.
The information is of great interest to everyone. In closing, I just want to ask you, what is your own personal, number 1, 2, and 3, interventions for achieving, a long and healthy life? What are you doing for yourself, or that you think has the most potential?
I think actually having for longevity and happy, healthy life, probably social connections are probably one of the most important things. Exercising, what I call playing, having fun, moving your body, jumping and running and going out and skiing or whatever, and then putting in the right fuel in your body. And food is energy and information, and when you feed yourself, always remember that you're feeding your gut bacteria, and there's certain kinds of foods that they need.
Okay. Well, thank you again.
All right, thank you.
I'm Dr. Ron Klatz, and for Immortality Now in Las Vegas, Nevada, at the A4M International Congress on Anti-Aging Medicine. I thank you for viewing us, and we'll be back next month with another issue of Immortality Now, and you can learn more about this topic and others at www.worldhealth.net.
Immortality Now is made possible in part by Hotze Vitamins, now offering customized vitamin packs. For more information, visit client.hotzevitamins.com.